Hi, my name's Ariel Mann, and I'm the head of communications for Chromie Health. Today, I'm sitting down with our founders, Douglas Ford and Scott Tisoskey, who were recently recognized for their work in Forbes 30 Under 30. Hello.
Hi, Ariel.
How you doing
How's it
today?
going?
Good. Glad to have you here.
Thank you. Glad to be here.
Awesome. I'd love to just get into this story because as someone who works with you, I think it needs to be shared. So please tell me, Doug, what happened in the ICU? Take me back to that moment.
It was peak COVID, and I was having chest pains, which I originally thought was COVID. They couldn't figure out what it was, but it got worse and worse and worse. And I'll never forget, I kept pushing the call nurse button, but there was no nurses coming because it was such a nursing shortage, which is crazy to think. When you're calling for help in a hospital, there's no one to come help you. And then I still don't know to this day how they knew that I was about to die, but they called a code blue, which means all hands on deck, this patient's about to die. And I started to pass out. And I'll never forget just seeing the nurses' faces just with shock and concern and me not even knowing what's exactly happening. Come to find out, it was myocarditis, which is a severe case of heart inflammation, and that nearly led to my death. So they sent me to the ICU, and I was there for 2 weeks. I wasn't able to get the care I needed because the nurse scheduling system's broken. The nurse burnout problem at that time was at a peak, and it's only getting worse. And so I knew in that moment something needed to change.
What point did you realize it needed to?
I would say while I was in the ICU, just sitting there dwelling over and over as to what happened. How did I get here? Am I going to die? Did I nearly die? And honestly, it was the nurses. It was the nurses that not only literally saved my life, but that I was able to talk to them and learn about nursing and really focus and hyperfixate on the problem of scheduling nurses, of a nursing shortage, and just how horrible it's gotten since the pandemic. And from there, that's where Chromie Health was founded.
And Scott, at what point when Doug brought this to your attention, did you take it seriously?
As somebody who's worked in many different areas of healthcare, from small rural family practice clinics to large academic hospitals, the problem is the same. Nurses are overworked, they're burnout, and they're undervalued and underappreciated. And so that's really when Doug came up to me with this idea. I was like, I'm all in. I remember working in clinical research at the time with heart transplant patients. And I remember watching the nurses in the OR argue about their schedules over an Excel sheet. And I said to myself, there's no way that these hardworking nurses have to take time out of their day to stress over a schedule. I said, it's unacceptable. It needs to change. And so when Doug came to me with that idea, I said, I'm all in.
Notice how he said Excel spreadsheets
Yes,
too. A lot of people
Excel.
don't realize that nurses schedule with Excel at the good hospitals. Some do pen and paper, which is crazy to think.
Well, why do you think that is, though?
It's honestly because before COVID, they did not take AI seriously. They did not take tech seriously. So they didn't want to spend the money to have some startup come and introduce a new scheduling system. But now, because there's such a massive nursing shortage, because the scheduling system is so broken, and because they're spending tens of thousands of dollars on travel nursing, they're taking AI pretty seriously, which is pretty great to see, to be honest, because we're so confident that AI solutions like Chromie Health can help save many people's lives and honestly make the lives of nurses a lot easier.
How do you feel when you're in these hospitals talking to these nurses? Like, what is the most common theme when they come up to you and tell you, besides burnout? Do they feel appreciated? Do they feel they're being seen, heard, and valued?
We come from a long line of nurses. So they've really helped build Chromie, which is why it's so successful. And they told us the biggest problem right now that no one's solving is last-minute staffing gaps. It's such a niche-specific thing, it's often overlooked compared to people who want a full scheduling software that'll try and replace the big giants. And it's not going to happen. So Chromie Health solves a specific problem, last-minute staffing gaps. And by solving that problem, the nurses have been ecstatic implementing it. They were a bit hesitant at first, just given the climate around AI and the concern of whether AI will replace nursing. It's not robotics. It's not going to replace nursing, you know? So it's really great to kind of walk them through the process, hear their concerns the first time, address those concerns, and then implement a life-saving solution like Chromie.
How does Chromie help nurse burnout?
A lot of these other AI players are trying to boil the ocean. They're too big. Nurse burnout is systemic and it's a vicious cycle. When one nurse calls out of a shift, everybody else has to take on additional patients. And that doesn't just impact the nurse and their quality of life, but also the patients. With each additional patient that is assigned to one nurse, that patient's risk of death goes up by 7%. But what we really want to do at Chromie Health is use AI as a solution to one of the worst issues in our country right now, and that is nurse burnout.
We've heard that Chromie Health actually saves hospitals millions of dollars. Can you walk us through that?
It saves the hospitals a lot of money. On average, about $320,000 per unit, millions of dollars in years in cost savings. And it's through many different avenues. Reduced agency cost, that's the big thing. So when a nurse calls out 4 hours before their shift, the charge nurse is not having to scramble, text everybody, call everybody on their day off, see if they're available. And if nobody can come in, which that happens a lot of the time, they have to turn to travel nursing, which costs tens of thousands of dollars. We've talked to some hospital executives who are spending millions, tens of millions, hundreds of millions of dollars on travel nurses alone and just agency fees. So it's incredible to see everybody benefit from Chromie.
It sounds like Chromie can benefit everybody and keep the peace between every level of the hospital field. So Scott, Doug, thank you so much for stopping by, sharing a little piece of Chromie with us, and we hope to talk to you again soon.
Definitely.
And thank you, Ariel, for helping get our mission out there.
It's
we
an
really
honor.
appreciate it.
Till next time, this is the Chromie Report.